All right, well, good afternoon, everyone, and thank you for joining us. I want to first off thank Dr. Moore, Ontario's Chief Medical Officer of Health, for joining and for his incredible partnership as we work together to reopen our schools. Now, I cannot imagine the difficulty families are facing as this pandemic continues. We believe so strongly that children need to be in school, that they are essential to the mental and physical health of a child and to their academic success. We have been cautious throughout this pandemic, and we've pivoted when required to ensure we protect our schools, our communities, and our collective progress as we work together to get kids back to school and our lives back on track. As you know, elementary and secondary students across Ontario will return to in-person learning on January 17th with strong protections in place, fully supported by Ontario's Chief Medical Officer of Health. The Ontario Children's Health Coalition, representing SickKids and CHEO and all pediatric hospitals, have endorsed the return to class. For students, this means that they can return to a classroom where they can learn alongside their peers, led by their teachers. Now, Ontario's plan to open and protect schools is focused on deploying millions of rapid tests to our schools and our childcare centres, enhancing ventilation and high-quality PPE, along with increasing access to vaccines for both children on a voluntary basis and staff. And as an additional measure, amid the highly transmissible Omicron variant beginning the week of January 17th, I am announcing that rapid antigen tests will be provided for schools in childcare and public schools, children in childcare settings, and students in public elementary schools. Staff and students will receive 2 tests each as an initial supply, with over 3.9 million rapid tests shipped to schools as we speak, ready for January 17th. These tests are for use when symptomatic, as outlined in the updated school and childcare screener that has been strengthened. We will continue to expand access to rapid antigen tests for parents, for students, and staff. And these tests will be made available for students in public secondary schools on a need basis. And more tests will be available in the coming weeks so that we can help limit the spread of COVID in our learning environments. This will build on the more than 11 million rapid antigen tests Ontario sent home with all children in publicly funded schools and private schools ahead of the Christmas break, the only province to do so on a proactive basis to reduce risk. We also know that vaccination remains our best defense in the fight against COVID-19. It is essential for everyone who is eligible to get vaccinated. Millions of vaccines have been administered, and we know they are safe. We know they are effective. Now, it is encouraging that 82% of youth aged 12 to 17 are fully immunized. That is brilliant as we continue to work to increase that rate. It is positive that nearly 50% of children 5 to 11 have received their first dose. However, there is more we can do and more we will do, which is why our government is launching school-based clinics to support greater uptake of vaccination of eligible children and youth that requires the consent of parents in this province. This is just another option that will allow parents and children to safely and conveniently vaccinate themselves with the full consent and approval of parents. Also, we'll continue to provide planned access and accelerated access at our education childcare staff. As you know, just days ago, we announced accelerated access for these staff, encouraging them to get a booster in a community across Ontario. It'll help support stability amongst our staff and keep students learning. We ask all education childcare staff to book an appointment today for a booster in your community. Our government just in the past week stood up 10 additional teacher, education worker, and childcare worker focused clinics that have preferential lines or standalone clinics just for them in the GTHA, with pharmacies and public health units right across Ontario working around the clock to do the same. These are 2 new important measures that will build on our comprehensive plan to support the return to in-person learning. That is supported by high-quality PPE, by providing access to more than 9 million non-fitted N95 masks to all education and childcare staff. We are the only province to do so in Canada, out of abundance of caution, with more than 4 million 3-ply high-quality masks for students that are actually on the way to schools as well. Millions already are there, with 4 million more on the way, just to be sure every student gets access to these masks should they need it. We're also further improving ventilation by deploying an additional 3,000 HEPA units to learning environments. This builds on significant investments announced by our government over the past year and a half. Every step of the way, we have increased ventilation. And as a result of those early investments, well before Omicron hit our country and our province, we were leading in ventilation. 70,000 HEPA units in schools since September. $600 million, over 2,000 major mechanical ventilation improvements in our schools that were underway. And together, this has really helped to ensure we have high quality ventilation in all schools, because every single school has been inspected. We use the highest quality filters, MERV 13s, and we continue to take action to improve the air quality within schools. And so much so that we believe in the transparency of that information, which is why since September, every single school in Ontario, all 4,800 without exception, have reported on their upgrades, on their improvements, on the number of HEP units in their school. That is on every school board's website and on school websites should they have a website themselves. But we're going further. We're deploying 3,000 more within our schools. We've also created a more stricter screening protocol for students and staff before they enter schools to help prevent any cases from getting there in the first place. We've delivered historic funding to school boards with $1.6 million of resources to protect against COVID. It could be for mental health, for technology, for staffing, and for better ventilation. And we have supported the stability of staffing with over 2,000 projected staff that have been hired, including educators, it could be custodians, it could be mental health workers. All of these individuals are making a difference in our schools. And this is in addition to the agreement we just reached that will allow us to nearly double the number of retired educators who can work within our schools. That's going to be critical. I want to thank them for stepping up. 11,000 last year alone did so. And we also have expanded access to teacher candidates. Thousands of teacher candidates will continue to work within our schools and help keep them open. We've also have time-limited cohorting protocols to limit direct and indirect contacts of children by pausing some of those high-contact sports, stricter lunch cohort protocols, and elevated cleaning requirements in all of our schools. And I want to assure parents, students, teachers, and staff that we are committed to providing students with a return to in-person learning with access to the supports they need to ensure stability and continuity of learning. As we adapt to this pandemic, we are building on our past investments and our efforts to protect against COVID-19 by bolstering rising rates of youth vaccine, significant ventilation improvements in all publicly funded schools, and high-quality PPE for students and staff. And in partnership with the Chief Medical Officer of Health, we will continue to monitor current public health trends and do whatever it takes to keep your child in class and as safe as possible. These and many other health and safety measures are part of our plan for a return to in-person learning, a plan that involves many partners. And I want to thank our school boards, our teachers, and our staff for the significant effort and contribution towards keeping schools open and keeping the kids as safe as possible up until December of 2021. And I thank them for their work on the going forward. I also want to thank families, and I want to thank students for getting vaccinated and for their cooperation and leadership at home. I know this has been tough, but we will get through this. And we are committed to providing our students with a learning experience that minimizes potential disruption, that protects them and their friends and their families and their educators. Thank you so much. I'll now turn it over to the Chief Medical Officer of Health.
Good afternoon, and thank you, Minister Lecce. I'm pleased that our students will be returning to in-person learning on Monday. Returning to the classroom with their peers is crucial for our children and youth's mental health, well-being, and development. I want to take a moment to recognize our parents, the students, and educators for navigating the last 2 weeks of online learning. I know it has been challenging and stressful, yet you have demonstrated incredible resilience and adaptability, something you have all shown throughout this pandemic. What was asked of you was not easy, and I thank you. As we prepare for the reopening of schools on January 17th, the health and well-being of students and staff continues to be a critical priority. Throughout the pandemic, strong public health measures, along with comprehensive interventions by local public health units, have been extremely effective in supporting schools to operate as safely as possible. And as we prepare for Monday, we remain focused on the measures that we know work. While the risk of transmission in school settings can never be eliminated, it can be reduced or mitigated through public health measures, including improved vaccination, better masking, ventilation, cohorting, and staying home when sick. And we continue to invest in support these important interventions to support our kids' learning in the classroom. As the pandemic has evolved, we have had to make changes to how we manage this virus. Omicron is a very different variant than Delta. While Delta had lower transmissibility and high virulence, Omicron is more transmissible but has lower virulence. As a result, our response to this virus has always been based on the latest science and evidence, and we have continued to be nimble in our approach. I know there's been a lot of questions on our change to testing and case and contact management guidance. And in the past, an entire cohort of children would have been sent home for 2 or 3 positive cases in a class, significantly disrupting classroom learning of students and impacting their households. Our new approach focuses on empowering parents and students. This includes providing take-home PCR, self-collection kits to become symptomatic while at school, but also rapid antigen tests are provided to students and staff as our supply is increasing, and enhanced screening measures are in place. With respect to testing, the use of take-home PCR self-collection kits in schools will only be used for students and education staff who become symptomatic while at school. These kits will be provided to students and education staff who become symptomatic at school. And as the supply of rapid antigen tests increase, the government will be shifting its focus to the use of rapid antigen tests in school for symptomatic students and staff. While parents must keep their kids at home if they test positive, the 5-day isolation period, if symptoms are improving for 24 hours, will ensure less disruption for both student learning and families, helping keep kids in the classroom and parents at work. I want to thank you for all your continued sacrifices, your tremendous resilience, and continued commitment to protecting one another through wave after wave of this virus. I understand that sending your children back to school on Monday will be worrying for many. The speed with which information changes and guidelines and advice are updated can be overwhelming. But please know that we continue to review the data, the evidence, and adjust health and safety requirements to ensure our schools remain safe and open for in-person learning. Protecting our children and getting them back to the classroom is important for me. We must always strive to have our schools the last to close and the first to open. We owe that to our kids. Thank you, and I'll turn it back to the minister.
Great. Yes, we can go to the floor for questions. I'll start if that's okay.
Sure.
Minister, Dr. Moore just noted right here that there's, of course, and you know this, a lot of questions about the changes to cases and contact guidance. And Dr. Moore mentioned that these changes will empower parents. How does it empower parents to make the right decision for their kids when they're getting less information now? What we learned today is that when 30% of students and staff are absent for any reason, not even COVID related, that the school will inform the public health unit, and then there's a chain reaction from there. Principals don't have to tell students, teachers, parents when there's a COVID case. Absenteeism does not have to be linked to a COVID case. How are you empowering parents to make a decision when they're getting less specific information than before the Christmas break?
Well, I'll turn it over to the Chief Medical Officer of Health, but I will say a differentiator in the past to the present is we now have rapid antigen tests in the hands of parents to be able to test their children twice to ensure that indeed they have or do not have COVID-19. That is going to be a layer of protection we didn't have. Of course, we awaited the federal shipment. We still need millions more that have been guaranteed. But the point is that is going to help empower parents with greater certainty to know if they have the virus. But I'll defer to the Chief Medical Officer of Health to contextualize that.
Dr. Moore, if I may, people want information to be able to make the best decision, and they're not getting that specific information anymore. What is the rationale for updating this guidance that provides parents, teachers with less information and doesn't oblige principals to provide any more specific information?
So as we've mentioned, we've had to pivot from Delta in prior waves to Omicron. Omicron is more transmissible but less virulent as a disease, and we've modified our protocols as a result. The empowerment capacity is having the tests in your home. If your child screens to have symptoms compatible with COVID-19, you have, and they're rapid antigen tests, you have an answer very quickly that empowers the parent to make the decision to keep their child home and to follow the guidelines of monitoring for 5 days if symptoms are severe. There's obviously an opportunity to seek health care. So that, we believe, is empowering. In the past, due to the limitations of access to PCR, we're trying to prioritize those tests for those that are the most vulnerable and maintain a reasonable turnaround time for that testing. It's essential that we have that capacity for our long-term care facilities, our hospitals, and for those that need treatment based on the PCR. So the empowerment now is that over the last 2 weeks, we've worked diligently to provide that access to rapid antigen tests to enable parents to make informed decisions with confirmatory testing in their household, quicker turnaround time, less demand to go to an assessment center, less wait for PCR testing, and having an answer at their fingertips within minutes, actually, of performing the test. I do believe that's empowering. I do believe that enables parents to have the decision in their home to get the test done and to make the decision of return to school. I can understand that schools reflect community activity. So everyone should know that the community risk is high now, and that schools will reflect what's going on in the community. Schools are not and have not been shown to be a significant multiplier of risk for communities. And the other measure that we put in play through the sacrifices that our Ontarians are making now from January 5th to the 26th further reduces the risk of transmission because the community risk is decreasing with the total number of social contacts decreasing. So empowerment means parents have the test in their home, can perform it in their home, and can make the diagnosis in their home with greater convenience, less going to assessment centers, and they should be aware that schools aren't necessarily multipliers of infection. They reflect the community. If your community risk is high, that would be the same for any school environment. The public health measures that we've additionally put in play, though, in Ontario is to decrease that community risk and decrease the burden on the hospital. Together with absenteeism data that will be shared with the public health units and communication directly to parents and families, will further identify if the risk is going up in any community at any defined period of time. I do want to acknowledge, though, that the risk over the coming 6 to 8 weeks will be higher, but we'll get through it. We'll have a better February and then a better March, and thank parents for following the guidelines, following the rules, doing the testing in the convenience of their home, and following the rules as they have throughout this last pandemic.
Dr. Moore, I just want to shift away from schools for just a moment. I'm curious what you think of Quebec's proposed health tax on the unvaccinated. Do you think this is a measure Ontario should be considering? And is there any public health value in a measure like that at all?
We have not made that recommendation to government ever throughout this pandemic. It's not one that we would bring forward. It does, in my mind, seem punitive. We have always been supportive of adults making informed decisions for vaccination and have tried to increase availability and accessibility. Only in the highest risk setting have we mandated it, and that was in the long-term care facility where all of us have realized that the sacrifice of being the increased death rate, the increased risk of severe outcomes had to be balanced by maximizing immunization and protection of those individuals. That is as far as this government has gone in terms of mandating vaccination and putting a penalty on those that have not been vaccinated has not been entertained by this government.
A follow-up? I just had one more question for you, Dr. Moore. Why can you not provide the data about positive cases in classrooms publicly reported online and provide the rapid test? You're saying the rapid test was put to empower parents. We hear overwhelmingly that this is the information people want, is the continuation of that public reporting.
So key metrics that we'll continue to report, and we're just generating these reports now, are going to be admissions to hospital for pediatric populations 5 to 11, 12 to 17, vaccinated, unvaccinated. We're preparing those types of reports so parents can see if there's severe or adverse outcomes and the proportion of those patients that had to be hospitalized. That will be ongoing, systematically reported at a provincial level and regionally for Ontario. We're just generating that database now, but I will tell you that the risk of hospitalization is very, very low in Ontario for children. So the numbers will be small and will be variable over time. We will also be reporting publicly on the PCR tests that are done, and they would be for clinical assessment or admission to hospital, and the proportion that are positive for children. So there are metrics that we want to make public to ensure that every parent understands that the risk from this infection, particularly the Omicron variant, is less than previous strains, that the risk to hospitalization remains low, and we've always had to have a risk-based and balance-based approach to this pandemic, and I think we're hitting the right mark with Omicron, and we will be transparent with all of those metrics.
Just for my follow-up, why are you only offering PCR testing to students and teachers that are symptomatic at school? Like, what's the scientific rationale between differentiating between a kid that gets symptoms an hour after the start of classes as opposed to before?
I'm so sorry. This was, we had pre-distributed PCR tests across the province to schools in partnership with our major pediatric hospitals. That system was working very well for Delta. Those remain in the school settings, and we wanted to use them as a bridge before we had RAT tests available. Given that we have now got an increased delivery of RAT tests from the federal government, we are now going to use the PCR tests that are in the school setting if symptoms develop, but also transition to increase the availability of the RAT test. All of that having to preserve the key role of PCR testing for outbreak management and long-term care, senior homes, hospital-based, and to our assessment centers where we're now using tests to guide treatment. And we do hope that the treatments, the oral antivirals, will be available to us in the coming weeks.
Can I ask about the 30% threshold? It seems like a high number, but it also includes absences. I mean, my teen skipping school could be included in that. Why did you settle on 30%, and is it actually meaningful if you're considering all these other reasons for the reasons why kids aren't there?
So we have plenty of experience using absenteeism data for normal viral respiratory seasons, and this is based on our experience aggregated over the years of influenza reporting and absenteeism associated with other viruses. So we do think that given the variation in reasons for absenteeism, a threshold of a rise of 30% most likely would represent increased activity in the community and would be a point at which we would want to acknowledge that, to review what's going on in the community and communicate that back to all parents. So it seems, based on our previous experience, that number has worked well for us.
And what do you think is going on with the vaccine uptake with 5 to 11-year-olds? Why is it so low? And given it is so low and how important you say vaccines are, why have they not been mandated in schools?
So it is a new vaccine, and as a result of that, we want a greater experience with it before we'd ever mandate it. And I don't think any jurisdiction in Canada has mandated the virus to date, or the vaccine to date. I'm sorry. I always would love to see a higher uptake of the vaccine. Early days in the United States, it's showing significant protection against the rare risk of hospitalization in children and use of the intensive care unit. It's almost a 20-to-1 ratio, just like we're seeing in adults. Relative risk is much higher in unvaccinated children compared to vaccinated children. I do think we'll see that same benefit of vaccination in children as we roll out our strategy. So we're at 47-48% at present. We want to increase accessibility, as the Minister said, have school-based clinics, consent-based with written consent from families, and increase the availability as we can. We have done some reviews. Parents are concerned that it's a new vaccine, potential side effects, the risk of myocarditis, pericarditis, all of those major concerns we've aggregated. So the Hospital for Sick Children has a call-in line, and they've aggregated the commonest concerns that have been identified, and now we're going to create a question and answer to be able to help the conversation to alleviate any concerns that parents may have. But I strongly believe in the benefits of the vaccination for this age group, in particular its ability to reduce severe outcomes such as hospitalization and use of intensive care unit. Please, sir.
Thank you, Dr. Moore. Just to build on that question and that concept, I mean, we've had great success with our 12 to 17s. We're at over 82%, 82.5% that are double dosed, one of the higher rates in Canada. And we've established that through partnerships with our pediatric hospitals, including Sick Kids, and we are so grateful for their work in creating that parental hotline to answer questions. We've had school-focused clinics accessible at schools and community centers specifically for kids, for their parents, siblings, and the staff as well. All of that has created a safe environment and incentive to go get immunized. What we're doing now is realizing that we want to increase that rate on a voluntary basis for elementary children, 5 to 11, looking at other jurisdictions, including Newfoundland, that has adopted a more in-school during instructions, during hours of instruction, that type of vaccine access could be made available. Now, yes, of course, it requires consent of parents, but the bottom line is more options for families to make it easier, reduce the barriers is the basis for which today we have announced a plan to get that program up and running, and some of those clinics will be up. Our plan is by next Friday. That's the speed by which we're moving because of the imperative of increasing vaccine rates and protecting these environments as much as possible. I also will note that part of the announcement today is also paired with rapid tests, so that 50% constituency of kids in elementary school, they're not immunized, and the fact that almost 98% of them are not double dosed yet, to make sure they're safe. Which is why on the first day when they go back to school, our government and the Premier has prioritized and literally in real time shipping 3.9 million rapid tests available on the first day of school for kits of 2 tests so that parents could test their children at home and increase the level of safety and assurance for themselves and for the kids and their peers in the classroom. That's going to make a difference. As well, we believe a ventilation focus in those elementary schools particularly, but all schools, where we have inspected every single school in the province. There are 4,800, 3/4 of them are elementary schools. Every one without exception has not only inspected their ventilation systems, that they've improved them. We have the highest quality filters. We use MERV 13s, which the emerging science over a year ago suggested is prudent, and we've been doing that for well over a year. We've encouraged the increasing of airflow within our schools. We run our systems 2 hours longer before and after to maximize fresh air intake. We've opened windows, and we've deployed 70,000 HEPAs, and it cannot be understated. When you compare us to all provinces in the nation, at least according to publicly available information, we have more HEPA units deployed in our schools than all provinces combined. That is leadership that will help improve and protect these schools. And more importantly, it'll keep the students and staff within schools in the first place, which we know is so important. I think another element I would just mention very briefly is the focus on also within elementary schools on more stricter screening at the front end, and also the rules that have changed. We announced them in December, but take effect, of course, for the return to school on the 17th, related to cohorting. Elementary cohorting when it comes to lunches, more stricter protocol in place where we don't have children outside of a cohort eating together. We've eliminated assemblies, school-wide assemblies. They must be virtual for a time being. We've also said, look, high contact, higher risk sports, wrestling being a compelling example, will have to be paused for now. All of this is very much focused on that unvaccinated constituency, but it'll help all children as we seek to get them back to school and keep them as safe as possible.
Okay, we'll go to the phone lines for questions now. Just a reminder, it's one question and one follow-up. First question.
From Richard Southern at City News 680.
Hi, good afternoon, Minister. Parents are wondering what's changed to make schools safe to return. And you, as you've just done, you point largely to N95 masks being sent to teachers and additional HEPA filters being sent out. Your government, though, hasn't detailed where those have gone. Minister, can you guarantee this afternoon that every teacher will have an N95 mask on Monday and every classroom will have a HEPA filter? Yes or no, sir?
We can absolutely commit to ensuring that the high-quality PPE N95s are within schools because, Richard, they already have been shipped to Ontario publicly funded schools by the end of last week. We've also shipping 4 million high-quality 3-ply masks, which is consistent with the evidence and the recommendation of the Public Health Agency of Canada when it comes to that requirement for a high-quality mask for kids. That's also being shipped for the 17th. Millions of masks already are there. We're sending additional ones just to be safe to ensure every child, should they want one, they will get one. Likewise for staff. And that's not just educators. That's school bus drivers, it's our custodians, it's the hardworking admin, secretaries, EAs, all of whom, should they want, will have access to that N95. Now, with respect to HEPA units, we already had in place in September 70,000 HEPA units. We've invested $600 million ahead of the start of the school year. We invested in improving the mechanical ventilation systems, 22,000 projects that were underway to improve those systems. And in every school that does not have mechanical ventilation, which is a minority, but for those that do not, to your question, we have already put in place a HEPA unit in every single classroom. What we're committing to today is shipping another 3,000 in addition to the 70,000, in addition to the $600 million of investment. And when it comes to the transparency associated with those investments, we required in September, I believe one of the only provinces, if the only province, to have said that we want parents to know themselves where these investments are going, the number of HEPA units in a school, and the quality of the filtration as well. And so we've required school boards in September, they all did it, all 72 school boards, to post publicly that type of information, that level of granularity that I think they are entitled to. And we're going to continue to do that, update it accordingly with these new investments, new shipments on their way. And also, not part of your question, but I think important, is the rapid tests. That we have 3.9 million rapid tests guaranteed for our schools, with an emphasis on, symptomatic kids and staff, childcare as well. All of this will be in place to step up the protocol and do everything humanly possible to build confidence for you, for parents, for staff, and just do everything humanly possible to protect our schools. And as I say, we will continue to be guided by the advice of the Chief Medical Officer of Health. Some of the steps we've taken actually exceed public health advice out of abundance of caution. And that's what we're going to continue to do in everything we can do to support our children and keep them in school.
Follow-up?
Minister, and being in classrooms are two different things. But for my follow-up, we've heard from some schools that have put out notices to parents asking them to be emergency school monitors. Is that correct? And also, Dr. Moore, for you, on January 3rd, you said you'd look to hospitalizations and ICU numbers to determine when schools return. Both have surged to record levels. Did you misspeak on January 3rd? If you could both answer those questions. Thank you.
With respect to staffing, I appreciate the question, Richard. There's three parts to this. The first is the funding we put in place for the second semester, $304 million of net funding from the province of Ontario to school boards to hire staff. And up to today, we project roughly 2,350 staff have been hired within our schools. More custodians, more mental health workers, more teachers, all the above, we need them. School boards have been challenged to find staff to hire in this environment, but there's 2,300 more as we project working within our schools and supporting stable environments for kids to learn. We also announced an agreement just days ago with the Ontario Teachers Federation to effectively double the number of retired educators who can help work in our schools and stabilize our schools. That's 11, just last year, for example, 11,000 retirees stepped up, and I am grateful to them for doing so. And part of the reason why they did is we removed any penalty with respect to working in schools by expanding access to now 95 days from what originally was 50. In addition, today we're also announcing expanding access to teacher candidates. About 3,500 teacher candidates last year stepped up second-year candidates. These are educators that are on their way to becoming teachers, passionate, young, qualified, and their deans of education, the relevant faculties have sort of selected these individuals because they're ready, they've got the maturity to enter our schools on an emergency basis or as on a time-limited basis. We're expanding that access again from second to first years as well to ensure we have that talent pool of individuals who can work in our schools and continue to inspire our kids around the curriculum and keep them focused on learning. And to your question, school boards have, well before the pandemic, always had an emergency supply list of staff available. Usually they were partners and community family members often that can come in on a time-limited basis to supply. Usually they'd be used and deployed for less critical elements. They often wouldn't be in an algebra class. They'd be, perhaps during cafeteria, lunch supervision, things like this. But the bottom line is that has always existed, and I know school boards are working on the first three elements, the teacher candidates, the retirees, and net new teachers to be hired with the funding our province has delivered before they'd pursue that option. But that option will be is prudent to have and have personnel available to step in just to make sure that these schools remain as safe as possible if we observe high rates of absenteeism within our staffing.
Next question.
Oh, and
We'll go to the next question.
From Holly Mackenzie-Suter at Canadian Press.
hi there.
Hi, Minister. Good to see you finally. I have a question following up on something Minister Elliott said yesterday at a press conference when we asked about any indicators that have improved public health-wise since the remote learning period was announced, because they have essentially gotten worse in hospitals since then. And she said that actually the government needed the remote learning period to get boosters to teachers and send out N95s. So as a follow-up for you today, does that mean that this latest period of remote learning was only necessary to buy time because the government didn't take those protective actions sooner?
We have continuously demonstrated an element of caution when it comes to children, when it comes to kids and staff. I appreciate the very real impact of closure on families, on kids, on their welfare and their mental health, and it's not lost on me how concerning that is for so many in the province. We made a decision out of abundance of caution as Omicron raged through the country and the world to take 2 additional weeks. As we observed other health indicators and as we worked as a collective to increase immunization over that period. Now, I will say, during those 2 weeks or week and a half up to the present, we really made a good use of that time. Because while we had that time, we were able to do as we intended, deploying those rapid tests. 3.9 million are on the way to schools across Ontario. We were able to stand up 10 booster clinics specifically for accelerated access to education staff. Now remember, 5 million Ontarians have already accessed a booster across Ontario. Many educators and staff have as well. Just another incentive, another encouragement to them to go get access at a clinic in their communities with a specific line set up for them to make it efficient. We also used this time to get N95s. We deployed 9 million of them specifically to schools. They already are in schools. In fact, Holly, they were there last week. And so we've made use of this time with one mission, which is to continuously improve the protections within our schools and to do everything humanly possible using every minute of the day to keep kids and get kids back to class. So over that period of time, we've set up booster clinics, we've sent rapid tests, we are sending more HEPA units, 3,000, and we have established a program for immunization for students and for staff that's going to make a difference. And the Deputy Premier, the Solicitor General, the Premier, all of us, the Chief Medical Officer, we are working around the clock to do everything humanly possible to ensure the safety of children and to get them in school where I believe they belong. And I think that partnership is benefiting our families in Ontario. And I think as we can increase access to the vaccine, to rapid tests, we'll build confidence and we'll get our kids back to class.
Follow up?
Yeah, thanks. As a follow-up on the rapid test, can you commit to a date when every staff member and student in schools and daycares is going to have their 2 rapid tests at hand? Like, is that going to be within the next week or weeks into in-person learning? And I also just, in your opening remarks, you said something about secondary students getting the rapid test on an as-needs basis. So can you just clarify if that means high school students are not guaranteed to get 2 tests each?
For sure. Look, we have, as you know, and I think as all Ontarians are aware, the province of Ontario has been waiting for rapid tests. I appreciate there's global supply challenges and procurement challenges, but the province was promised from the federal government millions of tests that have not arrived. The consequence of that is we are working with what is available, shared through the feds to the provinces, and making that work. Now, we have 3.9 million tests that will be in schools on track for the first day to be provided to all staff, to all children in elementary schools, all children in childcare, and the staff within those settings. We also have provisioned rapid test kits for high school on a need basis. And so as supply comes online from the feds, we are expecting over 1 million more tests next week. We'll bridge that gap. So what that functionally means is elementary kids will get those rapid tests at the front end. We're going to provide every high school with access to those rapid tests to use on a need basis for symptomatic purposes. And in the coming days, as the feds get us those tests that we are desperately need, we'll be able to get them into the hands of secondary students as well. Now remember, as the Chief Medical Officer of Health noted, we are the only province in Canada to have launched a province-wide take-home PCR test program. Appreciating that we are pivoting to rapid tests from PCO over time, but there's capacity in the system. We sent those out on December 3rd of 2021, and they weren't largely used, of course, because 2 weeks later, kids went home for the holidays. And so that capacity will also be used to bridge those gaps. And so we're working very aggressively. It's another call on the feds to get us those rapid tests, but most specifically when it comes to students, they will have access to it should they need it for any symptomatic child, any symptomatic student. And in fact, they benefit for the time being both from rapid tests and PCR take-home tests in Ontario. And we are the only province to do that. I mean, I was reflecting on what other provinces are doing when you look at the jurisdictional scans. I mean, you look at British Columbia, for example. I mean, they have no rapid tests set aside or dedicated for schools. I mean, their public health units have them, but none, as we are doing in Ontario, giving them to you, to Ontario parents, on a weekly basis. And I was reflecting on in-class, in-school vaccine clinics. We'll be one of the few provinces to have done that. We'll be the only province to deploy N95 masks to staff, exceeding the public health advice, the science table, and other recommendations, at least to date, on PPE quality. We got ahead of that evidence out of abundance of caution. We have the largest investment in ventilation by far in Canada. Started not now. We're not reacting to Omicron. We have had these investments and protections in place since September. In fact, we started even before then, but we really stepped it up last summer. And we are one of 3 provinces, and one of the first, as I recall, to have accelerated booster access for education and childcare staff. So we're doing everything possible. We are doing our very best to demonstrate to parents that the safety of your children is paramount, and that we've put in place the funding, the resources, and a protocol that is robust, that is comprehensive, and is leading in the nation in that respect. And we'll continue to do more over time to respond to risks that is always changing, to make sure that we keep these schools as safe as possible.
We'll go to the next question, and this will be the final question.
From Caroline Alfonso at the Globe and Mail.
Thanks for taking my questions. We learned from a briefing earlier that public health units and then families will be notified when the absence rate in a school reaches 30%. Dr. Moore, you explained how you reach that figure, but I'm kind of curious what happens then. What are the measures that will be taken? Will that school be closed?
I do want to assure parents that public health agencies at a local level will be in ongoing contact with the boards of education, not just when absenteeism rate hits a certain level. There'll be ongoing communication, ongoing sharing of expertise on infection prevention and control, and consultation. So that relationship with the school boards is and will be maintained between the medical officers of health and the directors of boards, as well as between staff. The other question that you had was regarding the 30%. So given that there'll be ongoing consultations as absenteeism levels rise at that given metric of increase, there'll be consultation between the health unit to understand, is there an impact on the health system? Is there what is the transition going on in that community? And a communication prepared to inform parents immediately of any potential risk and the risk assessment by the local public health agency. Does it reflect the community? Is it something unique to the schools, etc.? So there'll be an explanation and actions that families can take to further protect themselves, adhering to all the best practices that we've put in play for Ontarians.
Follow-up?
School offices right now have take-home PCR tests. Dr. Moore, am I understanding this correctly, that those are not going to be replenished and the government is going to rely on rapid tests? Because I remember you saying that those rapid tests were not reliable when parent groups were trying to distribute them to kids in their community. So what has changed there, and how long is this program going to be run? Is it 2 tests per week for a kid?
Well, thank you very much for the question. A lot of things have changed since the Omicron has become the dominant. There is a high prevalence of Omicron in the community, and hence we call it the pre-test probability of a test being useful to us. The pre-test probability, given the high level of community spread, makes the use of rapid antigen tests even more useful at a local level and at a family level. And hence, its use in this particular instance can be quite powerful. A true positive, if it's positive, we would consider it a true positive. If it's negative, we want 2 negatives 24 hours apart to confirm that it is not Omicron. The likelihood is much less with 2 negatives 24 hours apart. So our testing strategy has to have to follow the change in the virus, the change in the community risk, and we absolutely do believe that the RATs are much more useful now than they had been when we had very low prevalence in school populations in the past. So much more useful at this time. And the PCR tests were pre-distributed. We want to use it as a bridge to RATs. Because of the turnaround times of PCR, we don't want families having to wait 4 or 5 days for a response. We want you to have the answer in your home, empowered rapidly, that you can interpret it to understand whether your child is at risk for COVID or not. And that usefulness and turnaround time is best by using the rapid antigen tests. So there will be a transition. We want to use the tests that are distributed. We don't think the 200,000 or so will, unless they're all used within a short time frame, will be an extra burden on the PCR testing capacity of the province, and that we can deal with the volumes. We've talked to the Hospital for Sick Children in CHEO, and they do believe that they'll be able to process them as best they can. I'm sorry about the limitations of PCR. We really do need to keep them for the most at-risk settings, as I've identified, and for outbreak management in high-risk settings such as shelters, long-term care facilities, retirement homes, and in the hospital sector for patient treatment and management.
Thanks, everyone.